Well, folks, President Trump has made some bold picks. Now we have Pam Bondi for Attorney General. The big question for me is, what is RFK Jr. going to do once he gets into Health and Human Services? And now Dr. Oz is going in there to help out as well. Well, I want to bring in now Chief Scientific Officer for the Wellness Company, one of the best voices there is out there on just the government ineptitude when it came to the COVID reaction. Dr. Peter McCullough is with us. Dr. McCullough, it's so good to see you.
Great to see you.
All right, so what's your advice to RFK Jr. going in?
Keep in mind, he will be following Alex Azar and then Xavier Becerra, these two HHS directors that were basically bureaucrats. They became autocrats during the pandemic. And we understand now that, effectively, they fostered this new era of corruption in healthcare that swept through the agencies. There's over a dozen sub-agencies report to HHS. So as RFK, who has to get through the Senate confirmation process as he takes the helm, he's going to have to work through what I think is a giant web of corruption. And that may be job one before you can actually make any headway in terms of initiatives is figure out what in the world has gone wrong at these agencies, Grant.
I can't help but think we're doing a segment. You were with the Wellness Company. I got one of the Wellness Company kits. In here is Ivermectin. It works with COVID. They shut it down, the Ivermectin. That, to me, is one of the biggest travesties. I think it cost lives, Dr. McCullough.
Grant, it did. The ICON study that was published in Chest in 2020 by Dr. J.J. Rajter showed that ivermectin, this is a very good prospective comparative study, it reduced mortality. It was started and carried through the hospitalization. Do you know every hospitalized patient should have received ivermectin based on those data? It's safer than Tylenol. We never were going to have the large conclusive trial, which would have been 20,000 patients in each group. So we had to go on the best available sources of information. And it was really a shame that patients were not only denied ivermectin, patients admitted were denied monoclonal antibodies, which were also safe and effective, adequate doses of corticosteroids. They were denied nasal sprays, which turned out to work, colchicine, and the list goes on and on. We're going to have to do I think a deep dive on what happened during hospitalized care. Do you know none of the hospitals in the United States, Grant, claim to be a center of excellence for the treatment of COVID? I wonder why.
None. It's amazing. So I have to believe this partnership, if you call it that, maybe you call it more like a organized crime syndicate between big pharma and government agencies. Dr. Oz is now going in as well. Will his role be different from RFK Jr.'s? Is there something specific you'd like to see Dr. Oz dig into?
Well, remember, Dr. Oz is a retired cardiovascular surgeon. He's Harvard trained. He's also, a media host who did incredibly well in media. So he made a lot more money at media than he ever did as a doctor. But I can tell you that, he hopefully will restore some physician guidance over the administration of Medicare and Medicaid. Right now, it's a young woman who looks very inexperienced. She's not a doctor. It looks kind of like a DEI pick. It's said that she's the most influential person in healthcare right now, our current CMS director. But Dr. Oz should be able to go in and tackle some things. Robert F. Kennedy has pointed out that we spend more on healthcare than virtually any other country. And half of that spending occurs in the last 30 days of life. Boy, I'd love to see Dr. Oz tackle that big spend in the last few days of life.
Well, if you want to prevent getting the last 30 days of life and you got some need for prescription medications, how about that for a little segue to your kits? I want people to go and get one of these, and we so appreciate you coming on, Dr. McCullough. It's great information, but again, folks, these are the kits. The address is on your screen. There's 8 prescription medications in here, including ivermectin, antivirals, antibiotics, antiparasitics in here, all good stuff. twc.health/voice. Dr. McCullough, it is great seeing you.
Thank you.